Morning, everyone. Just a quick update on where we stand with the coronavirus situation. We are in the midst of rescheduling well child checks as well as annual health evaluations for a couple of reasons. Number one, to make sure that we're available to see our folks that might have either come in contact with or exhibiting symptoms of the coronavirus or any other acute respiratory illness or acute illness for that matter, but also to help reduce the overall exposure that our patients might have by being out in the community. As you may have seen from the news and even the recent press release, let me pull this up here, press release from the governor and the CDC, we're being asked to essentially practice common sense medicine, if you will, not just physicians and other healthcare professionals, but the general public, i.e. wash your hands, don't congregate with folks in large groups unless absolutely necessary, and even then, give us some scrutiny. Give your thought process some scrutiny about whether or not you should be doing that. Anyway, the governor's press release also asked us to do the very thing that all of us as physicians have been doing, which is to prioritize medical appointments, medical procedures, elective things, and so on and so forth. Hence us rescheduling annual health evaluations and well child checks. I fully anticipate this will be a distant memory within the next couple of weeks. So we're just trying to put folks, push those non-urgent appointments off until end of the month, beginning of next month. One of the more common questions that I have been receiving is, should I be tested? And the short answer is not everyone needs to be tested. In fact, there's only a small percentage of folks that really should be tested. Our testing kits are limited in number. That may change in the next week or two, but at the moment the CDC is really encouraging us to be very proactive about who is tested and who is not tested. It's not one of those things where if you develop a tickle in the throat or a runny nose or a sore ear that you should be tested. It's really development of symptoms which are highly suggestive for contracting coronavirus. Fever, shortness of breath, respiratory distress, etc. There is some information here from the 9th on the Department of Health and Human Services CDC site, and I'm trying to keep our own website updated. But the short story is, if you're hospitalized with hospitalized patients exhibiting certain signs and symptoms compatible with the coronavirus, they should be tested. Other symptomatic individuals, fever, shortness of breath, respiratory distress, or those that are in an immunocompromised state should be tested. Healthcare professionals who have had close contact, but otherwise mildly ill patients are encouraged to stay home. Certainly give us a call or spruce us if you're a direct primary care member. If you have any questions about what your symptoms may or may not be indicating, but we are really trying to do our due diligence with the limited testing we have to prioritize those folks who are being tested and those who we can simply watch and wait. Fortunately, the overwhelming majority of folks who contract coronavirus have been exhibiting mild to moderate symptoms, very responsive to what we call supportive and or conservative measures such as rest, fluids, don't pick your nose, wash your hands. For that matter, watch a Netflix series, take a Udemy or Coursera course, enjoy some time with your dog, etc. So really, we appreciate everyone's understanding that we may talk with you and say, no, we don't think you need to be tested. And it's not that we don't care about your health and well-being. We're just trying to prioritize those folks who should be tested versus those folks who we can simply watch their symptom either improve or develop. So anyway, we're going to try and keep this updated. There's an update on our site. There's a press release from the Governor Mills' office, as well as some ongoing information from the Maine Center for Disease Control. And again, we'll try and keep you updated as much as possible. So stay safe, stay healthy, wash your hands, don't pick your nose, pick a great Netflix series, take a Udemy or Coursera course. And if you have any questions, feel free to email or call. We are offering virtual visits through telemedicine for those that are interested. If so, give us a holler. Otherwise, talk to you later.